Certainly, they're not all unemployable. But, although it wasn't contained in my submissions here, we have also spoken about a massive public works program. You see, when nations are on the verge of, I don't want to say collapse, but when we have serious problems like this, the state has to do certain things to deal with the problem. Because if the state doesn't deal with the problem will not be solved. Because as it is now, although we would prefer to use the private sector and make sure there were businesses all over which could absorb all of these individuals, they aren't currently there. 70 or 80% of the private sector is in the informal sector. So even in that public works scenario, which has been tried in other countries before, at least for a temporary period of, let's say, 5 years, you can make sure people are fully employed, at least to maintain their dignity, whilst there's some retraining going on, whilst there's some additional skills they're given, and whilst a proper stabilization of the system takes place to find out what other openings and other areas they can be absorbed by to make them useful members to themselves and their families and society.
Thank you very much. Since you are on the issue of nurses, let me just bring in Mr. Kweku Asante-Krobia, who is the president of GRNA, because I am assuming his question will be within the same area. So, Mr. Asante-Krobia, where is he? Thank you. Please send the mic to him. He's the president of the Ghana Registered Nurses Association.
Thank you very much, Mr. Moderator. I was actually expecting to hear more about health in Mr. Greenstreet's presentation, but I guess in your composite manifesto, you have more of that in there. I hope to see that in the coming days. But I shudder to inform you that the people I represent, nurses and midwives, arguably the largest healthcare professionals within the care continuum and at the front line, are walking the tightrope of ensuring quality care for the people of Ghana, dealing with the stark reality of a nurse-patient ratio of 1:22, and yet this is the time we are seeing situations like graduate nurse midwife unemployment. I believe that the people of Ghana are not expecting nurses and midwives to perform some magic to ensure that the people of Ghana, their clients, receive quality healthcare service. I wasn't convinced about the last answer you gave to the last questioner's question. But should the people of Ghana make you the next president, how are you going to ensure a safe bridge for nurses and midwives to cross this crisis?
Thank you.
Thank you.
Well, unfortunately, I have to repeat some of the things I said before, but maybe try and expand. Because I think, as we all are aware, the situation exists as it is at the moment because I believe there's a freeze on employment as far as these nurses are concerned. Whilst at the same time, as you've rightly pointed out, we have this problem with nurses-patient ratio, and we have this problem, as I indicated in my delivery, of needless deaths during childbirth. So clearly, there's a lot of work that these nurses can be doing. The issue is that we haven't been able to take the decision to find the funds to make it available to pay them. And that is a political decision. And that is why I am saying that I know the Convention People's Party, because we have discussed it, are in favor of absorbing all of those nurses, not just the ones who are trained by government, but the ones who are also privately trained into the system, whilst at the same time building new hospitals, which unfortunately takes 3 or 4 years. We have to find where we can place them in the existing structures that are there. And one of the places that I was alluding to was these CHIPS compounds, where you have what I've noted down here as these district health management teams who oversee these CHIPS compounds. At these compounds, there's one resident nurse. That one resident nurse is normally in charge of training community health volunteers who take care of the kinds of issues that you had alluded to. However, what we could do is try and temporarily absorb all of these nurses into this area around the country so that once again we know that they are fully employed, they have employment, they have an income, they're earning a salary, they can contribute to themselves and their family, so that as time goes on, we see how we can feed them into other parts of the system which would be able to absorb them based on the skills that they all have.
Thank you very much. We'll now take a question from the convener of NetRight, Ms. Pauline van der Palen.
Thank you, Mr. Greenstreet. I appreciated your remarks tonight. One of the things that we have realized is that when it comes to election time, there's a lot of lip service paid in terms of affirmative gender and women's rights. And half of the time we hear about our government signing on to regional and international frameworks, but when it comes down to the domestic level, very little is done. You've already mentioned the affirmative action bill. There's also the interstate succession review. There's the spousal property bill, all before Parliament. Now, given what we have had as our previous non-experience of, let me say, active engagement around women's rights, what would an affirmative action look like under your stewardship? And how would you ensure that the other bills that were mentioned were both passed and implemented in such a way that women across the country would feel that their issues are really being paid attention to?
Thank you.
Thank you very much for the question. I think you will be very much aware of the historical antecedents of the Convention People's Party and what it represented as far as women were concerned, and what we were able to do in the First Republic to ensuring great representation of women in Parliament and in national affairs. So it forms part of our natural desire to ensure that these affirmative actions that you've been referring to are properly implemented. But yes, there is some kind of lip service played, you're rightly so, as around election time. But unfortunately, it's not just around affirmative action issues. At election time, there's lip service played to a whole load of issues that take place. In fact, that is when everybody gets up and starts getting busy. But what I can tell you, dealing with the issue, first of all, personally, once again, because it's important, and then administratively to try and tackle your question, is that I, as the person who introduced me said, I'm the son of two professors, one of whom happens to be my mother, who happens to be a gender activist and who brainwashed all of us in our house that this is what needs to be done. So, number one, you are preaching to the converted. And in terms of implementing laws, making sure detailed aspects of those laws are properly implemented, it's about setting up teams which are going to implement them that have belief and desire in their implementation. And so what I can assure you is that you would find a listening ear and a committed team of people who would be interested in ensuring that the Interstate Succession Bill and so many other pieces of legislation are not just implemented, but implemented in practicality around the country and have the desired effect that the clauses within them, which are dealing with socio-economic issues that affect the daily lives of women, actually become reality in their practical lives.
Thank you, Mr. Greenstreet. Now that we are still at this area, let me bring in a member of the Ghana Federation of Disability Organizations, Mr. Juventus Durina, to pose this question.
Thank you. My name is Juventus Durina. I represent Ghana Federation of the Disabled. Thank you for the beautiful presentation, especially around education. That's where my interest is. Looking at the Article 24, Section 1 of the UN Convention on the Rights of Persons with Disability, that requires state parties to recognize the right of persons with disability to education. With a view to realizing this right without discrimination and on the basis of equal opportunity, state parties are to ensure inclusive education system and lifelong learning direction, among other things. Just recently, policy on inclusive education was launched, and the guideline is not clear. We don't know where the target is. I ask you, when you become the next president coming January 2007, what are you going to do to help the inclusive education be reality? Thank you.
Thank you, sir.
Yes, thank you very much for the question. Inclusive education is critical. And, you know, unfortunately, it can't be implemented now, because what, first of all, has to happen is that teachers have to be trained vis-a-vis inclusive education. And therefore, they have to be trained in how to do sign language. They have to be trained in Braille writing before there can be proper inclusive education in a normal classroom setup. Because I think what you are referring to is the universal design learning model that they've tried to introduce in the area of disability. And what that will able to achieve would be quality education for all. But maybe what can happen initially is perhaps some specialist teachers at the kindergarten or nursery level who could gradually integrate the children in the system as time goes on. I know that with autism, you can have some special care assistants who can work with them and enable them to be part of a normal classroom. But that would only be mild autism. So there's quite a bit that has to be done if we're going to achieve the target and the purpose of inclusive education that you're referring to. And we are committed to providing additional funds, especially for those who need that training and who are engaged in that specialist assistance area to enable them to carry out their duties effectively.
Thank you very much. We'll take a question from a board member of WaterAid, Dr. Sylvia Annie Akwete. She doesn't appear to be there.
I am not Dr. Sylvia Annie, but I am the Dr. Shaka Uzundu from WaterAid Ghana, so I'll ask a question on her behalf. Thank you very much for your presentation. You spoke about sanitation, and you spoke about open defecation, child mortality, infant mortality in particular, and you mentioned 90 deaths per day. You spoke about poverty. All of these are intertwined with water, sanitation, and hygiene. So my question is, as the new president of Ghana in 2017, or if that happens to become the reality, how would you address the massive sanitation challenges which you alluded to, which face Ghana? Thank you.
You know, nothing is more depressing, and I'm sure my senior comrade Peter McMahon will testify to this because he's always in the Western region. Nothing is more depressing when you drive around the Western region, particularly where all the rivers and water bodies are, and you see the extent of the pollution that has been caused by the environmental degradation that has taken place over there. So if we don't take steps very, very quickly, we're going to face a very, very serious situation in this area too. Because water is life. And I think that is why it is placed so high up in these recent sustainable development goals that have recently been brought up. And so we are in a country where we have vast water bodies, and yet so much of our water bodies, even from the Volta River, goes, into the sea, millions and millions and millions of liters. So how we tackle what we're going to do with those water bodies in terms of protecting them and how we're going to use them to create further productivity and utilize them for agriculture, but also the water bodies that are closer to the urban areas which have become polluted and have all these problems that you refer to, requires a plan of action. There are a number of research studies that have been conducted, and there are some plans that have been put into place that we need to aggressively bring onto the front burner, not the back burner as it is now. And I think that requires a lot of public education for Ghanaians to also understand what a serious condition that we are faced with vis-a-vis the water situation.
Follow-up, sir. Now that you mentioned water pollution, we do know that Galamsey is contributing a lot to that. And in your previous answer, you didn't seem too sympathetic to the plight of mining companies.
Yes.
What's your Galamsey policy?
Yes. Just the other day, I was having a conversation with Mr. Kwanzaa, the owner of TV Africa. And he told me, oh, Ivor, I was enjoying a very nice orange the other day, and the orange was so sweet. And then a friend of mine tapped me on the shoulder and said, Aguko, don't eat that orange. He said, why not? The orange is so nice. He said, it is sweet because of the cyanide. Wow. It's called Obuasi orange. Mm. So, I mean, my goodness, you know. Yet at the same time, we are confronted with not a law and order situation with Galamsey, but a serious socio-economic situation. Because thousands upon thousands upon thousands of households have now become dependent upon it. Some people are even selling their cocoa farms for short-term gain for those who are coming to do Galamsey. The question we have to ask ourselves, since we are here to talk about solutions, not discuss the problems, and in our discussions internally, although, as you rightly said, I didn't bring it in my submission, we believe that Galamsey should be legalized. But we can't legalize. It's already illegal. So small-scale mining is legal, okay, but Galamsey is illegal. Good. Okay? So we have to do far more for the small-scale mining sector, because after all, despite the unfortunate environmental degradation, the money stays in Ghana. These large gold mining companies, 80% of the money they take out is